All right, everyone. Well, thanks for tuning in and welcome. It's 6 o'clock on the East Coast. My name is Gregory Zengo. I'm the host for this Dermapen 4 medical microneedling CME training course webinar. And we're going to get started in another 3 or 4 minutes, let everybody else get logged in and settled in. And I'm planning on talking for about 10 or 15 minutes. And luckily, I grew up in New York, so I can talk real fast because I have hours of stuff in my head. And so who knows what's going to come out. But we're gonna go into a lot of different topics here in a short period of time. And then any questions you have, feel free to type them over in the comments box. And when we're done, I will work on answering those. So hang tight for a few minutes. Thanks for logging in and taking time out of your busy Wednesday. And we'll get started in about 2 more minutes. All right. Well, thanks for joining. We'll get off to a slow rolling start here. And if people are still coming on, they can pick this up as we go. But my name is Gregory Zengo. I am an OBGYN by trade and formerly an Emory University assistant professor and in that field. And I started in aesthetics 22 years ago with vein treatment, Botox and fillers, and over the years have added a lot more services as we've gone. And I really am happy to be here talking to you tonight specifically about CME level training in microneedling and why microneedling is the perfect discipline for rigorous evidence-based CME training. I want to thank DP Derm, the makers of the DP4 Dermapen 4 pen, for having me tonight. So hopefully we'll be able to answer some questions about what CME training is, what some of the things are that you can learn, and then we'll open it up for some questions and comments at the end. I started microneedling in 2014, 10 years ago, and I have gone through 5 microneedling pens since then. Just to give you a point of comparison, I have played golf for 40 years, and I don't think I've used 5 different putters. It's been very frustrating. There's been a lot of problems with hardware along the way. Finally, we got the FDA to step in and standardize some things a little bit in 2018. And since then, I have bought 3 FDA-cleared microneedling pens. I own half of them. And one of the things that has gotten me excited about microneedling again in 2023 and 2024 is this DP4 pen, which I really call the iPhone moment for microneedling equipment. And just like there's an iPhone, there has to be an app store. And so the tremendous variety of serums and home care products, a great durable disposable head that's reasonably priced, all those things sort of make up the app store. And this has reinvigorated my interest in microneedling even as a physician. So anyway, getting back to my history, before I started doing microneedling in 2008, I formed Practical CME Medical Training. And here's the website for that. And we've been going strong ever since. Everything we do is CME accredited. We train in a number of different cosmetic, aesthetic disciplines that you see here on the dropdown. We also have wellness training, which is now all fully online. We were doing that even before the pandemic. Everything is CME accredited. And we have live hands-on in 10 different cities around the United States. So later on, take a look at practicalcme.com. Our interface that we have for training courses, and if you sign up for any of our courses, including this special DP4 version of our CME microneedling course, you will get a viewing window like this. You can log in and log out anytime you want, as much as you want for 2 years. You can look at all of the different topics here on the left. You can even search for topics. You can click on any slide you want, play that slide again. We have downloadable resources over here, which include a printable slide syllabus where you can take notes, an editable needling consent, and a really important cheat sheet of how to quickly choose the right products, depths, endpoints, no matter what your indication is. So looking through this, you can see there's a lot of material. It can be watched in one sitting, or you can take your time and go even longer. And the reason for that is because we have a lot of clickable links to the medical literature as you go. So I think this is a really nice platform. People really like it. We've been using this system for a while, and if you do pause, it will remember where you left off. So getting back to our program, you're going to get the streaming access for 2 years with free updates. So anytime we add new papers, new information, new protocols, that will automatically get pushed to your account and you will get a message. So it is fully interactive. You can click on those links and get extra information anytime you want. The thing I really love about microneedling in general, and now with the advent of the Dermapen 4, is that this really is the ultimate aesthetic procedure for the 2020s. And the things I love about it, compared to some of the things we had 10, 15 years ago, real expensive equipment and lasers that plug into the walls, we have inclusivity. Just about anyone who walks into your office is a candidate for microneedling. It's just a question of what their pathology is and how to design the right treatment for them, but we don't have to exclude certain skin types or even really many ages. Customizability. This is another thing that I love about it, and there's evidence to show how to do this. It's not a protocol, it is an art, and it requires design. So there are different indications, there's different depths that you set on the pen, of course, there's different endpoints, there's different repeats, different agents, and then different adjustments as you go based on their results. There's nothing more affordable than microneedling treatments. I don't know too many patients who get out of my office for Botox or fillers for less price than a microneedling treatment, yet it brings in the benefits of the exfoliation of a microderm, the conditioning of the superficial layers of the skin that a superficial chemical peel will do. And for things like acne and scars, it gives you the same results as laser treatments without the expense and without the downtime, all in one procedure, all in one little device you can hold in your hand. And from a business side of things, because you are all either providers in this or thinking about being providers, the margins are around 70%. And that's pretty good because your time is valuable and the equipment is relatively inexpensive. It can be paid off quickly, and you're not paying half of your margin to a drug company like you are with toxin and filler. Couple of slides from the actual presentation, that I want to go over just to kind of show you how we approach this, is that microneedling has a real sweet spot in that it is fast growing, but there's very low competition, but moderate awareness, meaning not everybody on every block is doing this like Botox and dermal fillers or maybe laser hair removal. But it's also not completely unknown and foreign to patients like PRP. Patients know about microneedling a little bit. Maybe they've seen the non-FDA pens on Amazon. Maybe they've seen some home rollers. Maybe they've heard some things about it. Maybe they follow Korean skincare and where microneedling rollers are very popular. Needless to say, this is a very friction-free thing to add to your practice. It doesn't add a big cost barrier, and a lot of patients are very receptive to it. Another slide we have in our presentation is this one, and that is you have got to know, you have got to approach every single patient in your practice as if they think microneedling is some big $50,000 machine that plugs into the wall, that they're going to have a lot of downtime, and that there's going to be a lot of potential pain and a need for anesthesia, because these big equipment makers are hijacking the term microneedling and using it on equipment that goes very deep and uses energy and doesn't do truly what microneedling is supposed to do. So that's another thing, is we've got to defend our turf on this word, on this term, microneedling. Next, what I want to talk about is microneedling in the literature. Think to yourself, how did you learn how to counsel patients? How did you learn how to choose them? How did you learn how to select the depths and the endpoints and the intervals between treatment? Did you do it because of what you read in a book or what you saw online or what somebody else does? But believe it or not, a lot of that is codified in the medical literature. And we try to take as much of that as possible and put that into our course. So you will see full text links that are clickable that will open up to the entire article. These can be both in vitro and full clinical studies. And hopefully you can choose to use these things to shape your counseling and your practice as you go. So here's an example slide from the course. And this name and date that you see at the top is clickable, and that will open up the full text of the paper and you can get more information. And one of the nuggets I get from this is that when they tried to massage a large molecular weight pigment into freshly microneedled skin, they got good depth for about 30 minutes. And then after 30 minutes, it didn't go any deeper. Now, there could be a lot of different reasons for that. But the bottom line is, when you have something like this that you read, how does that shape the way you approach your patient? How does that help you decide, what am I going to apply to that face in the office versus what am I going to tell that patient to do an hour or 2 hours later when they get home? Because each of those steps might give completely different results microscopically. Another slide we have is this great summary review article on microneedling and melasma. Did you guys know that there's actually a 459 patient meta-analysis on microneedling and melasma out there? And it shows a strong correlation when using microneedling coupled with the right topical therapy to get significant improvements starting as soon as 8 weeks or at the end of the second treatment, with the largest effect being 3 to 4 months. So what do I get out of this? First of all, I tell my patients who have pigment issues and are frustrated that, hey, we've got evidence. This is the approach. I expect you to see some improvement at this interval. I expect you to see more improvement at a later interval. Of course, with pigment, it's an ongoing process, and we're going to continue to want to hammer away at it over time. But I have the confidence, and I can quote the literature. And I think your patients want that. They don't just want something that is going to be, oh, let's try this and see if it works. Because when I work within the parameters of the literature and I have the best equipment and I have the best topicals, it seems like I get the best results. And that's one of the things that excites me, is now I get much better results with this equipment, with my knowledge coupled with it, than I did using Skin Pen and Micropen Evo, the other two pens I've used in the past. We get in a lot into indications, and because we're continuing medical education, we can talk about both on-label and off-label indications, and I think that's really important. We go into detail about endpoints and repeats, and we consult the literature on that, because there's a lot of microscopic processes that are going on in the skin after you puncture it with the needle channels, but also depending on the topicals that you use. And then, of course, we talk about how to actually perform the treatment itself, because there's a lot of nuance there. And again, I ask you, how did you learn any of this yourself? Because a lot of times when people get another opinion, another look, they can get better and actually get better results. Finally, the last part is, what is the value of CME? Before I talk about that, a couple more slides from the course. So the 2 FDA indications for needling are here highlighted, but most of the cases I do are on the other indications, because you get amazing results when you couple the right depth with the right treatment intervals and the right topicals, both in office and at home. So we go into great detail about all of this. And when I bought my other microneedling pens, I got a brochure about 3 or 4 pages long, talking about just basic starting points, but not a lot of education. And Dermapen and DP Derm have plenty of books and topics on the subject. It can be a lot to read. One nice thing about our course is that we boil it all down, and we are allowed to talk about these off-label indications. Here's another example of how the course will make your life a little bit easier. We've taken these really great home care starter kits, and I like to give these to everyone who gets a new treatment package with us. I usually do treatment packages of 4 treatments. When they start that new treatment package, I like to give them one of these kits. Well, how do I choose the kit? I can consult this chart because it tells me what is in each kit for each step in the process. These abbreviations are gone over in the course, and so you will know how to choose the right kit at a single glance. So the last thing is the value of actual CME. So CME stands for Continuing Medical Education, and our credits, and you will be able to print your certificate at the end of the course. And those credits are accepted by AANC, which is the big nursing consortium, AANP for nurse practitioners, AAPA for PAs, and of course, AMA for physicians, as well as MDs and DOs. You can use these for your license renewal every 2 years. CME certificates are often required in many states. You can also send this to your medical malpractice carrier and request a discount on your medical malpractice insurance, or use it when renegotiating with a different company. You also, like I said before, will get the 2 years access with the free updates, and this field is changing a lot. We're constantly scanning the literature for great new articles. And the last thing, and this is a special that I haven't told anyone about, but embedded in the Dermapen microneedling course is a $300 off coupon. So if you want to train in Botox and filler through us online, PRP, smooth PDO threads, we have a course in that online, or any of our wellness courses, that $300 coupon is in our course. Well, we've upcoded that coupon to $500 off if you use it before the end of August. So that can defray all of the cost of your microneedling class. So if you like it and you want to learn some more things that may be synergistic with microneedling, or get another opinion and get additional CME credits, you can do so. Want to go on ahead and show just a couple more things before stopping and taking questions. So at the end of this is the online post-test. So there's no interaction with any human beings. There's no faxing or anything. When you're finished and you've learned the material, you go on ahead and click Start Quiz. When you pass the test, you will get a downloadable certificate immediately. Some of those slides that I mentioned that have that clickable link, you will actually see the full text of the article open up, or at the least, an important abstract. And then finally, there are also some treatment videos that are narrated, and here's an example of one of them that we have. Those are all embedded or linked to in the course, and they're private. So hopefully this can help a lot. And for any additional information about the course, for instance, if you want to see the entire course outline, what it contains from top to bottom, you can go to the link that I have posted in the comments and read more about it. So I think I'm going to pause my comments at this point and go on ahead and get my screen fixed here a little bit and see if there are any questions, either verbal or in the chat.
So just on that note, this is our first time doing one with this particular platform, and I think everyone was put on as a viewer. If people do, which means they can't put on their microphone.
I see. Okay.
In the bottom right-hand corner of the page there's a little symbol with 3 different, like a triangle, a square, and a circle. If people click on that, I believe that they can ask a question and write it in Q&A if they choose Q&A.
I see it.
And just while we're talking about that, any of the people that are on tonight will get a 40% discount off Dr. Zengo's microneedling CME course. And we'll be sending a link for that after tonight.
While we await the questions, I'm going to go on ahead and also tease the series that we're going to do with additional topics, and we're going to get a little bit more in detail with some of the things I think that people who are considering needling or are already needling but maybe aren't selling as many treatments as they would like, or are not getting the renewal rate maybe that they would like. So we have come up with 8 topics that we're going to be pursuing between now and the end of the year, or possibly it might spill into January a little bit with the holidays. And so evidence behind the procedure, of course, is really important. I'm going to sort of pick my favorite papers out there and go over them and how they've shaped my practice, but more importantly, the way I counsel patients. Of course, we'll go into details about indications that work and how soon you would expect results, the incredible importance of treatment serums and home care. And this is a really important thing we mentioned in the course, and that is half your benefit comes from the needling channels themselves, doing them at the right depth for the right indication and in the right intervals. That's half your benefit. The other half of your benefit is your serums that you use during the treatment and the home care. And I think that's why I wasn't getting such great results, because some of the other platforms out there don't have a lot to offer in the way of treatment serums and home care. I mean, glycerin doesn't do a whole lot, if you know what I mean. How to introduce microneedling to your patients. I think it's really important because a lot of patients will not come into your office self-identifying that they need microneedling compared to, say, Botox, because they've seen 5 of their friends already have Botox, and so on and so forth down the list. So I think there's a lot of potential great discussions we can go over as well. Licensed, I'm going to start going over some of the questions. Licensed estheticians can take this course and print a certificate. However, taking this course and completing it does not change your legal scope of practice in your state. So it will not allow you to treat a certain condition or go to a certain depth that you maybe can't due to constraints of your licensure in your state. So do keep that in mind, but it will help you be a lot more rounded. Another question, what is different from this course and other courses? I don't know. I haven't really seen many of the other courses. I will tell you, we were the very first one to get CME accreditation in 2014. We probably refer to more of the medical literature than the others. Anything else I've seen regarding webinars for other courses tend to just focus on the product they're talking about and not really focus on the medical literature. We're completely opposite. Our course was built as a rigorous CME course right from the start. And what we have done with this version of the course is added in additional content specific for Dermapen 4 users, specific to their hardware and their treatment serums and home care. The organizations that will accept the CME credits. So what I would ask you to do on that one, and let's see if I can put this in as a question. Hopefully, yeah, you see my question at the end. Go on ahead and click that link. And when you click that link, you can find the drop down that says CME accreditation statement. And it talks about all of that. In addition, the ANCC, the Nursing Consortium for Registered Nurses, also accepts AMA Category 1 CME credits. We're going to add that to the listing as well. They have gotten a lot better at accepting AMA credit for physicians. AMA CME credit is the gold standard for CME credit worldwide. It is also reciprocal into Canada and most other foreign countries. Next question, and if I didn't answer your question, please go and type a follow-up in. Can you speak about how DP4 limits skin drag? Yeah, I think that's really important. Well, first of all, you have to have sharp needles, number one. Second of all, you have to have high RPMs, because if your RPMs are slow, then you're going to be spending more time as you pass the head across the skin with the needles in the skin and not out of the skin. So I think that's really important as well. But also, that's about all you can say about equipment. Your technique is really going to be the thing that's going to limit skin drag. And the two things that are going to be most important there are, number one, moving quickly with the needle head and with a certain confidence in your strokes, with a small amount of overlap and continuing to move those strokes and overlap and getting at least your 3 passes done as quickly as possible, but also keeping the skin very, very wet with treatment serum. That's going to be crucial because, again, if there's friction, then there's going to be increased pain and drag. The cost, if you click on that link and go to the bottom, you will see a referral to DP4. This can, the Dermapen USA, DP USA, sorry, their site, they are the only people who can sell it. Practical CME does not sell this version of the class as well. One other thing about skin drag that I forgot to mention is with all of the other pens, they have a spring recoil. And so by tapping the head into the skin and then expecting it to recoil passively under a spring, you're needles are spending more time in the skin as you pass, whereas DP4 has the direct drive. So it's not only pushing the needles into the skin, it's pulling them back out. Very similar if you've seen a champion racing cyclist. They don't just step their feet on the pedals, they clip their feet into the pedals so that they can pull upward on the pedal as they push down and get twice the muscle activity going on those stroke. Fragrance, that's a good question. And fragrance is such a general term. And what I would say about that is that the fragrances that they use, I have not found to be irritating. I will say that some of the serums give maybe few hours of redness after the procedure, maybe compared to other ones. And that's a kind of an individual thing. Like, I have not seen the same serum give a side effect in every patient I've used. So everything has to be individualized. However, the fragrances used in the DP4 products are compatible with needling. And that's very different than needling through something that you go down to Walgreens or CVS that's meant to be used on intact skin that you're then trying to drive into the skin with your microneedling channels. So keep that in mind. But if you do have someone with really sensitive skin, another thing you could do is do a test patch. And you can just do a little test patch and needle that into an inconspicuous area and see how they do if someone is really very sensitive. Are the subjects on the left sidebar entrances into the subject material or just a single slide? So when we show you the, hang on, let me see if I can share my screen again. So right here, those are individual slides. And when you've already watched a slide, it will gray out. And so each one is different lengths. Each one is narrated and they change in a automated way. So you don't have to actually manually change them. You can see there's a blue bar at the bottom that's moving along as the soundtrack goes with it. So that's how it works. So if you press play once, and you sit there and you have your notes in front of you, you can take notes along the way and you don't have to click around if you don't want to. But if you ever did want to go back somewhere for research, further research, you can do it using that guide. Regarding technique, do you give instructions and pearls in the course to perfect the technique? Yeah, and the art to individualize the patient, definitely. So right now we have 3 treatment videos posted that are narrated for 3 different indications. One is for pigment, one is for active acne and anti-aging, and then one is specifically for scars. And scars are completely different. And so we're going to talk about that in one of the future webinars. It's a different way of approaching microneedling, different depths, different intervals, different serums. Everything is different, but amazing results. So that's one thing I really like about it too. But yeah, of course, we talk about that. But one thing that's really important is that the individualization of technique is mostly in your brain. It's not in your hand. It's not in how much pressure you put on the skin or how you do your strokes. The individualization is, number one, how you talk to the patient, how you get them set up for good expectations, and then what depth you choose, what serum you choose, and what home care you choose. But if you get across all of those levels and you have their expectations right, and they know that they're not going to look completely different after one treatment, but they're going to see gradual improvement, maybe starting in treatment 2 or 3, possibly treatment 4 if it's scars, and you meet those expectations, you'll have a patient for life. And that's one of the things I want you to think about. And that is, if you're not getting 80 to 90% of your needling patients renewing, coming back, picking up new packages and continuing, then maybe something's not clicking with them. So that's really important. Let's see what else. Took certification when purchased DP4 3 years ago. How is this course different? Beatrice, I'm not familiar with the old course. I'm not sure it was CME accredited or it had the links to the literature that this one does. But you will get, like I said, somewhere between 20 and 25 links to the medical literature. customized consent forms and videos. Everything in this course is brand new. It's all been made by Practical CME. We've been using this along with platelet-rich plasma. They've been embedded in the same course for 10 years, and we've now split microneedling out. Back when I first, as a physician, first learned about microneedling, it was as a reason to drive PRP into the skin. Now we realize, of course, and most people have realized for a long period of time, that microneedling as a standalone is great. And actually, I do microneedling as a standalone 90% of the time now. I don't do it just to drive in PRP, which is originally how the device was presented to me 10 years ago. Let's see. I don't think I missed any other questions. I think I've got everything. Some of the things you talked about, you've asked questions about, we will address in the future webinars. I'm going to put that back up on the screen here.
I think a few more questions just came in.
Okay. Then let me not do that, because then I can't see the questions. Please comment on the use of topical anesthesia. Some of your patients don't tolerate the treatment. So DP Derm has a product that you can use, and you can also use some of the traditional anesthetics out there like BLT cream. In the CME course, we talk about 2 different strengths of BLT cream. And of course, there's some controversy, because if you don't really wash the BLT cream off very well, you end up driving it into the skin, and that could hamper some of your results, create redness, things you don't want to, the results you don't necessarily want to get. Although we know that the triple anesthetic creams are very effective. The things I would tell you that we have noticed since getting this pen, this pen, I find you need a good 20 to 30 minutes of whatever topical you choose on the skin. In the past, the pens I've used in the past, the head depth was not accurate. So I thought I was going 1 millimeter, and really I was going 0.8 or 0.75, which is probably why it was so comfortable. Or the RPMs were lower, or it had only 11 or 12 needles in the head instead of 16. And so you lose a lot of effectiveness there too. We could get away, though, with putting our cream on 10 or 15 minutes before. Now we are really strict about it, and we want ideally 30 minutes. So whatever topical you choose, please leave it on for a long time. Have them wash their face, leave that cream on for a while, wash again before you do your clinic prep and start the procedure. And I think that will help a lot. I've actually played around with some split face testing when we do hands-on in the classes, because sometimes I'll have a student say, oh, I'm fine, I don't need any topical. And I've convinced them to put topical on only half their face, and they say it's a dramatic difference. And because what we do is we put it on for 30 minutes, because I have them all go wash their faces and put it on, and then I talk more, and I can talk. So it's on for at least 30 minutes. Yes, personal, we cover hair, very important. And exosomes, we're going to cover that in one of the big webinars with all the latest information that is out there. But that is very exciting and new. Another comment about Rejuvepen. So if you really want me to be frank about the other equipment, I would rank Rejuvepen 5th out of the 6 available microneedling devices out there. Kind of low RPM, not really thrilled with the sharpness of the needles. I definitely would say it's better than Candela Exceed. Maybe I'd rank it 4th. Might be better than Micropen Evo. But other than that, I don't see a lot of redeeming qualities to it compared to some of the other competition that's out there. But DP4 is #1 with a bullet. That's an old phrase for music charts. But it's insane how much better my results have been. So when using SkinPen or Micropen Evo, the results that I was getting in 4 to 6 treatments, I'm now seeing in 2 to 3. And I chalk that up to the quality of the needle head, the density of the needles, and also, though, the treatment serums and the home care. Like I say, it's a marriage, 50-50. The pen, the technique, the depth, and the treatment serums and home care each are responsible for 50% of your results. So I've been really, really thrilled so far. And then Linda made a comment about her anesthetic cream. So I used BLT 20/8/8. Another thing you can do too, if you have patients that are maybe struggling a little bit with discomfort, is you can turn the RPMs down somewhat, and that might help. I find one real problem patient that I haven't found a solution for are people with fibromyalgia, because I think a lot of them perceive vibration as pain, and there's a bit of a mix up there with some of the neurons, and there's varying degrees of severity of fibromyalgia, so not everyone's the same. And even if someone says they have fibromyalgia, I would still do a treatment, but I would stay very shallow with that first treatment, maybe turn the RPMs down a little bit, make sure that the anesthetic was on for 30 minutes. All right, any other questions? If not, I'm sorry we went over about 7 minutes, but we kind of had a lot to cover. So definitely take a look at the outline for the course. And if you have ever been interested in getting into things like platelet-rich plasma and incorporating it with your needling, you will get $500 off any of those online classes, Botox filler, sclerotherapy for veins, even our wellness classes. Maybe you've been interested in getting started with counseling for weight loss and using GLP-1s. We've got something there too. And so other than that, I am done. I appreciate it. And
just one thing, Dr. Zengo, you're going
yeah.
to have, did you have the update for your the future webinars? Because we had a few topics. Did we do that already?
Yeah, I flashed it on, but let me end with that. Give me a second here and I will present. So there we go. There's 8 of them. And we're going to kind of shuffle them up and order them up. And I think we're going to start with the first one in 2 weeks. And we'll be doing them on Wednesday nights. And these 8 topics should get us through the end of the year, maybe slightly into early 2025. And of course, let your rep at DP Derm know if there's a specific topic you want us to cover. And we'll put that up as well. But I'm excited about all of these topics. I think they all really have unique applications to microneedling. Microneedling is so different from any other aesthetic procedure. Like I said, it has a value. It has a inclusivity that really nothing else does. And virtually every patient that walks into your office is a microneedling patient. So if you think about it and you start the conversation with what don't they like about their complexion, you might hear a lot of very good feedback and find that you have some tools in your microneedling toolbox to help them out. All right, anything else? Well, I appreciate it. And if you have any questions, just feel free to reach out. And thanks for your time. Enjoy the rest of your Wednesday night, everyone. And come on back and I'll see you again in 2 weeks. Take care.